Good evening, everyone. You are welcome to yet another session of the Community Health Champions Fellowship. Today, we shall be talking about strategic community engagement. Like we all know, strategic community engagement is one of the pillars of Community Health Champions Fellowship. During our orientation, we stated three pillars: public health principles, which we are done with that, strategic community engagement, and project management. So today, we'll be delving into strategic community engagement. Please, if you can hear me, I just need you to say yes in the chat for me to understand that we are flowing. My name is Zachary Siaka Oshaku. I'm the lead instructor, Digital Innovation School of Health. If you can hear me, please. All right. Okay, thank you very much. Yes. So yeah, thank you so much, Abdul Mominu. Thank you so much, Faith Godeka. Thank you, that's enough. So without wasting much time, what is the first thing that comes to your mind whenever you hear community engagement, strategic community engagement? I'm sure certain things come to your mind. Okay, strategic community engagement, is a proactive approach aimed at fostering meaningful interactions and collaborations between organizations and the communities they serve. WHO has defined community engagement as a process of developing relationships which enable stakeholders to work together in order to address health-related issues or challenges, and as well promote the well-being to achieve positive health impacts and outcomes. This is the definition of community engagement by the World Health Organization. If you could see, the highlighted word there in the definition is the stakeholders. So we need to understand who the stakeholders are. Who are the stakeholders? The stakeholders in the community engagement are people of diverse background. They could be individuals, they could be groups, there could be organizations or institutions that have a particular interest in the well-being or development or outcome of a particular community or locality. So by this definition of who the stakeholders are, anybody can be a stakeholder in as much as the person is an individual or is a group or an organization or institution with interest on the issue at hand. And it's important we understand how to identify and engage these relevant stakeholders. It's important for us to have effective community engagement initiatives. Now, these are some of the examples of the relevant stakeholders that we have. Generally speaking, we have the residents and community members as stakeholders, local businesses, government agencies and officials, non-profit organizations and community groups, educational institutions, faith-based religious organizations like synagogues, churches, mosques, and so on and so forth, media outlets, special interest groups and advocates, healthcare providers. These are generally examples of the various stakeholders that we have. So it depends on the approach you are trying to tackle that will determine the kind of stakeholders you should have. For instance, if I want to tackle a particular health challenge, I need to understand who my stakeholders are. First of all, I'll look at the government agencies. I'll look at the healthcare providers. I'll look at the community. Those are affected by the particular public health challenge. And if I have to tackle this, maybe there's a need for me to do an advocacy in one of the primary healthcare centers. I'll look at the government agencies. What is the state agency? The agency responsible for, the organization and coordination of the primary healthcare centers in a state. Some state call them State Primary Healthcare Board. Some state call them State Primary Healthcare Commission, whatever, or agencies. You need to identify who the relevant stakeholders are. Now, why strategic community engagement is important? Strategic community engagement is important based on three solid points. Number one, it's important because it helps us in establishing trust. It's important because it helps you gain valuable insights of a problem. It's important because it helps in promoting mutual understanding between stakeholders. Coming to number one, establishing trust. Because if you come genuinely with a particular intention to solve the problem of a community, first of all, you need to engage them by understanding what their problems are. You don't come with the notion that you know what the problem is. You engage the community members through meaningful engagement mechanism. You try to uncover what their needs or what their challenges are. So doing, it helps in establishing trust. Yes, this person is genuinely interested in solving our problem in this community. You don't assume what the problem of the people are. You rather engage with them to uncover what their problems are. And doing this, it will give you insights, some valuable insights about how big the problems are. And it helps you in promoting mutual understanding between stakeholders. They will know that, yes, you are a partner in progress, not an enemy, and you get the best of attention that you deserve. Understanding community. In order for us to understand community, three key stuffs are very vital. First, we need to understand how to identify stakeholders. Like I told you, it's important. You must identify who the relevant stakeholders are in any community that you intend to carry out your intervention. And communities are comprised of diverse stakeholders, such as the residents in that community, those doing businesses in the community, the government agencies within that community, the various non-profit organizations existing in the community, and all other institutions domiciled in the community. It's essential to identify and engage with all relevant stakeholders to ensure inclusive decision-making. The essence of these is to ensure that we don't leave any of the stakeholders behind. Because if you don't carry the relevant stakeholders behind, it means you are not doing a strategic community engagement, because some people will have this feeling of being left behind. And as such, they might try to fight against whatever intervention or whatever initiative you are trying to solve or bring to the community. So it's important we carry all relevant stakeholders in because of our engagement. Analyzing needs. The essence of analyzing needs, you have to conduct a thorough needs assessment. Conducting a thorough needs assessment helps you to understand the unique challenges or what their needs are, what their priorities are, what the aspiration of the community are. This insight informs the development of a tailored strategy. You don't assume what the problem of your community are. You don't assume what the problem of your people is. You rather meaningfully engage them by carrying out a needs assessment, maybe through focal group discussion or interview. You engage them personally. What do you think? What could be the problem of this community that you always have cholera? You may say, oh, we don't have access to clean water, we don't have access to toilet facilities and all of that. In the course of doing this, you are analyzing their needs. Mapping network. Visualizing the social networks within the community helps you to identify influential leaders, or what we call key opinion leaders. Every community has KOL, key opinion leaders in the community. So it's important you try to identify who are the relevant stakeholders. These people are very influential in the community. By getting them involved in your advocacy or your intervention is going to add voice to whatever intervention or initiative you are trying to carry out at the end of the day. Now, these are the strategies. I have 10 of them that will help you in identifying who the stakeholders are. First of all, whatever intervention you intend to carry out, it's important, please, I emphasize, it's important you define your goal or your purpose of carrying out such intervention. Defining your goal or the purpose helps clarify the objectives and the scope of the community engagement initiative. And you need to understand what are your goals. Understanding your goals will help you to achieve what you have intended to carry out at the end of the day. And as well, identifying the purpose will help you focus on relevant stakeholders. So if your goal is not properly defined, you end up getting stakeholders that are irrelevant to the particular intervention which you want to carry out. But by proper definition of your goal, it helps you get the relevant stakeholders that are needed. Stakeholders basket is quite very huge. And trust me, you cannot exhaust all the relevant stakeholders. There are so many. So it is based on the particular initiative or intervention which you are trying to carry out that will determine what your stakeholders are and who your stakeholders should be. Number two, you map the community. Please, who is doing this with on our slide? Somebody is making an alteration to this slide. So, I beg your pardon. You map the community. You have to conduct a thorough assessment of the community to understand the demographics, the geography, the socioeconomic status, characteristics, or what the key issues are. Mapping the community, you need to identify which part of the community do you want to carry out the intervention. Of course, you cannot address the entire community. You can say a particular area or close to that community. And how do you do that? You carry out a thorough needs assessment. You need to understand who are the people, what tribes majorly are the people. Are they a particular set of tribes? Are they a particular set of religion, or they are mixed together? How is the geography of the area? Is it a waterline area, or is it a topographical area? Is it an area that experienced drought? You need to have the characteristics of what that demography of the place you intend to carry out. What is the major issue that you need to address or that you want to address? You need to identify what the key issue is. This will provide insight into the diversity of the stakeholders and their interests. Because by the time you carry out a holistic needs assessment, it will give you an insight of who the stakeholders are. Okay, we need traditional rulers for us to carry out this intervention. We need to engage the members of the community. We need to engage the business people. We need to engage the political group. We need to engage the CBOs, community-based organization, and so on and so forth. Identify primary stakeholders. Stakeholders can be categorized into two, basically. We have the primary stakeholders and the secondary stakeholders. You start by identifying primary stakeholders who have a direct interest or influence in the initiative. There are some people that have direct influence or interest in the initiative. These are considered those that are directly affected or those that can be influenced directly by the initiative or intervention. These are the primary stakeholders. This may include the residents of the community, local businesses, government agencies, and community-based organizations. The fourth, consider secondary stakeholders. Secondary stakeholders are those who are indirectly affected by the initiative or intervention, or who have a less obvious stake. They don't really have that stake per se. It's not pronounced. So this could include the neighboring communities, environmental groups, advocacy group, and what have you. Now, the fifth point is assess stakeholder influence and power. By the time you have these stakeholders, you need to understand what their roles are. Understanding what their roles are, you need to understand their power. What are their duties? This can help you prioritize your engagement efforts and determine the extent of involvement to know how you can engage them. For example, I want to carry out an intervention in a particular PHC. I need to understand what are the powers of the PHC in charge. Do they have absolute power, or do I need to go to the State Primary Healthcare Board for me to introduce myself, for me to have a power that I can bring, that I can come to a particular facility and say, okay, I've been mandated or I've been in partnership with the State Primary Healthcare Board. I want to carry out this intervention. So you need to understand what their powers are. Engage stakeholder networks. Recognize that stakeholders are often interconnected through networks and relationships. You need to understand what connects all of them. Okay, if you are carrying out an intervention in a particular PHC to curb, cholera, you need to understand what connects them. The point of connection here is the issue of health. The point of connection is the issue of health. So you need to understand, in whatever initiative you are trying to carry out, you need to understand the thin line that binds all the relevant stakeholders together. Consider how you are going to engage these relevant stakeholders, and you need to identify individuals or groups who are likely to support or oppose the initiative. You need to find out, when you want to do risk management of the intervention you need to carry out, who are the people that possibly is
to miss out on the chance to be part of the investment revolution. Save the date, March 19th, 22nd, 2020.
I need to keep muting these people so you need to understand those who you need to identify who the champions are and those who can be possible opponents, those who can oppose your intervention, and you come up with your strategy on how to engage them. Okay, engaging both champions and opponents can provide valuable insights and opportunity for dialogue. You need to seek input and feedback. Engage stakeholders directly through surveys, interviews, focus groups, community meetings to gather input and feedback on their interests. One of the means of engagement is interviews. We interview people. Okay, in this community, where do you get your drinking water, source of drinking water from? Some could tell you, we get it from well, we get it from motorized borehole, we get it from a stream nearby. These are interviews. Or you administer a survey in form of a questionnaire and you share it to the members of the community, either digitally or using analog methods on a paper format for them to fill. Okay, where do you get your source of drinking water? From a stream, from a well, from a tap? They will take, how you just basic questions that will help you get some insight. Or you need to carry out interviews, or you need to do what we call focus group discussion. By focus group discussion, you gather the people of a particular age bracket, together, and for them to interact and discuss on the particular issue. All right. So this participatory approach ensures inclusivity and builds trust, because you are making these people uncover what their problems are by themselves. By proper engagement, it shows your genuine, love to solve a particular problem. You are not imposing what you think the problem should be on the people. You are making the people identify what their problems are and see how together you can come up with a solution to solve the problem. There's a need for a review of existing data and resources. It's important. A lot of people don't use this to identify what are the existing data. Are there any reports, on a particular intervention which you want to carry out, or something related to the community or issue at hand? You need to identify the stakeholders and you need to understand what their roles and perspectives are. Okay, this can save time and resources in the identification process. Okay, for example, if there is a data that shows that rate of exclusive breastfeeding in community XYZ is 10%, you don't need to go and start doing work all over to want to find out the rate of exclusive breastfeeding, how low it is in the community, because there is an existing data that you can trust. Maybe there is an existing data from a reliable organization that says this is what the problem is. You will leverage the existing data, to give you an overview. This can save time and resources in the identification of the process. And number 10, you need to regularly review and update. It's an ongoing process. So there's a need for stakeholders identification. And by the time you have your stakeholder identification is an ongoing process, and this may evolve over time. For instance, if you start an intervention, you may have gotten your stakeholders. In the process, you might realize that, oh, so person should have been consulted, so person should have been consulted. So you need to get all the relevant stakeholders in place to ensure you have all the relevant people in place, okay? You need to have regularly review and update your stakeholders list as new stakeholders emerge. Priorities shift, or engagements circumstances changes. Please beg your pardon. I'm just a little bit distracted here. So regular review and updates, you need to ensure you get that. It helps you to keep you in check. Okay, so now these are some of the clear-cut strategies that we can use. These are some of the clear-cut strategies that can be considered. in terms of community engagement, you need to have a clear communication channels. You need to identify what your means of communication is going to look like. Are you going to use any of the community forums, online platforms, regular newsletters, or facilitate two, uh, two-way communication whereby you can communicate and also get a feedback in the process? And you need to have active listening mechanism. The problem with most people, if you're engaging community members, people tend not to listen because they have something, a prepared problem that they come with in their mind. So they are not ready to listen to any other person because they have this notion. They are already identified what the problem is. So we're not ready to listen to any member of the community. No, you need to listen actively. Active listening will help you a lot because it will show empathy, it will show respect, which will foster trust naturally from the people. Because by the time you listen actively, when once they are telling you their problems, and you realize how pathetic this problem is, you need to show empathy by being very emotional about that. Oh, so sorry about that. You should show respect. I can understand what you people are going through in this community. Oh my goodness, I can't imagine being in a community, without access to potable drinking water. How do you survive drinking this muddy water? Oh, it's quite pathetic. I'm so sorry about that. But let's see what can be done. Active listening mechanism. Because if you listen with rapt attention, engaging members of the community, listening to what their problems are, listening to their needs attentively, where you need to be emotional, where you need to show respect. So, if you need doing this will give you an advantage. It will give you an advantage of, fostering trust from the members of the community. And thirdly, you need to have a transparent information sharing system, providing timely and accurate information about organizational activities, decisions, outcomes, promotes transparency and accountability. Whatever you're doing with the community, this shows reporting. You try to carry the members of the community along. Okay, we're trying to understand what your problems are. By the time we understand what your problems are, you go, okay, these are the problems that we have identified. These are the solutions in tackling these problems that we think could be relevant. What do you think should be included, or what do you think should not be part of this solution? You get their input, and as you get their input, there should be information sharing. It helps in effective decision making and collaborative problem solving approaches. Engaging stakeholders in collaborative problem solving processes empowers the community to contribute to solutions. Not just solutions in the implementation, but solutions, or they make contributions in the planning of the intervention. Because sometimes a lot of people make this mistake. They engage members of the community for solutions, but they fail to engage them in the early stage of planning. Whatever intervention you need to carry out in the community or with the people, let them be part of the problem. Let them be part of identifying what the needs are. Because you may think cholera is their problem, but maybe the malaria is their problem. And you are coming up with an intervention to tackle cholera, they will also be looking at you. Who the hell do you think you are? Like during COVID, a lot of countries were, though it was an emergency at that point in time, but people felt, because the members of the community were not properly engaged, they felt, our problem is malaria. We don't even know what COVID is, and you're disturbing us with vaccines here and there. Why don't you tackle the main problem that we have? So this strategic plan. Hello, can you hear me? If you can hear me, just type yes in the chat, please. I know we're having some, just one or two people. Yes, thank you very much, Taiwo. Thank you. So this is very important in developing your strategic plan. You know, whatever intervention you need to carry out, you must have these 4 things in mind. Number 1, SMART goals. You know, you need to identify who the key stakeholders are. And you need to ensure how you're going to get your resources, you know, how you're going to allocate, coordinate resources. And you need to have evaluation metrics, how you're going to measure your progress or the impact of whatever intervention you are carrying out. Okay. So first thing first, setting SMART goals and objectives. See, I can tell you, no matter how passionate you are, you cannot solve an entire problem. The only thing you can do is to solve what you can do. Okay. For example, you cannot say, I want to solve the problem of malaria in Africa. No, you there cannot do that because you don't have the relevant resources. You don't have, it's beyond you. It's not something that you can do. You can only be part of the solution. So if I were you, tackle the problem of malaria in a small community for the next 2 months, you know, this is a SMART goal, because when we say SMART goal, your goal has to be specific. You know, it must be something that you can measure, and your goal has to be articulate, and it has to be realistic. You don't set a goal that's beyond you, that you don't have resources for, that you don't have expertise for. And the last T is timely. Your goal should be time bound. You know, whatever goal you set, you should have a time bound that you want to achieve this. Okay, by the end of, or in the next 1 week, I want to train 10 people on prevention of hypertension. You know, I want to train 10 people on the preventive measures of hypertension, whatever you want to. This is something very simple, because number 1, it's variable. You've stated the number of people that you want to train. It's quite very specific, articulate, it's realistic, and it's timely, because you are giving yourself a week. Okay? In setting, you need to ensure you have all the. So the next point is the relevant stakeholders. Like we said, if you want to strengthen people on on the prevention of hypertension, for example, you need to identify who are the relevant stakeholders. Is this something that you can do? Do you need to get a cardiologist? You know, and you need some relevant healthcare workers. You need the attention of nurses and all of you and all of that. You need elderly people to be part. You need influential people, community members, maybe traditional heads in that community. You engage them. Okay, we realize because there's a surge in terms of the rate of high blood pressure in this community, and one of the interventions which I want to carry out is to, you know, create awareness to about 10 people of the community, you know, within 1 week. This will help them to increase their knowledge in terms of preventive measures of hypertension. You know, just, you have to be specific, and you need to understand, you need to identify who are the relevant key stakeholders and engage them meaningfully. The essence of engaging them, like we all know, is to get their buy-in, is to get their opinion, is for them to understand that they are part of the solutions, you know, part of finding the solution and all of that. This point is very important, because it's going to help you in your capstone project, because like we said, this fellowship, there's going to be a capstone project which is going to come possibly next week. Okay, so it's important, once you want to do your capstone project, you need to have your SMART goal. You need to identify who the relevant stakeholders are. Do you have sufficient resources, needed to finance whatever intention or initiative you want to carry out? In most cases, I always tell people, there is the latter part. People are not leveraging the free resources that we have. When we talk of resources, the first thing that comes to people's mind is financial resources. There are time resources, there are human resources, there are technological resources that can help you in terms of your community engagement, be strategic. How many of you carry out, can use a digital platform to engage strategically to members of the community? With this, you don't need to spend much money. All you need is your data, maybe 500 MB, and your technical skills for you to operate whatever platform you want to use. If it is Facebook, you do it on Facebook. If it is on LinkedIn, Twitter, there are quite a number of platforms, digital platforms that supports you to gather a community and discuss with people. So you need to understand the pattern or the tool that is best for you. If you want to carry out a forum, in a community forum where you can have some women or mixed male and female, or a particular age group, and talk to them on a particular pressing issue of member of the community. Like I said, it's always important. Don't assume what the problems are. For example, if you want to talk to youth, what are the health problems of the youth? You don't assume on their behalf. You engage the youth. What do you think are the health problems that most youth are facing? Maybe just through a questionnaire, and you do that. Like I did say, one of the measures that we intend to ensure that we are making impact with this fellowship is by, when we threw the question that how many of you we need 75 years to ensure that are ready to get or to do, to have a look of what the certificate is all about, before we could do that, is an evaluation metrics to ensure that yes, at least we are getting close to 50% of the participants responding to the initiative. Because if you are not evaluating, if you are not measuring what you are doing, you wouldn't know whether you're making impact or not. You could just have 200 people on a platform and everybody is sleeping. Nobody responds. People don't even check the messages and all of that. So how would you know whether you're making impact or not? But by getting people engaged meaningfully, by getting people and carry out a vote, or you throw out a survey, and at the end of the day, you get responses for the survey. And this helps you in evaluating to ensure that you make progress or not. We're talking about establishing evaluation metrics. You need to define relevant indicators or metrics that you can use to assess the impact or effectiveness of your engagement. And these metrics, it can be participation rates, it can be satisfaction surveys or outcomes achieved. You need to look at, okay, what have you gained from this program? You are trying to get feedback, or by asking questions. Has your knowledge of this improved from so, or how much of your knowledge has improved after attending this session? So you must have these 4 key things anytime you want to develop a strategic plan. Okay, first, setting SMART goals and objectives. You need to set SMART goals and objectives. What do I want to achieve? And you need to know how to identify the relevant key stakeholders. And you need to understand how to allocate resources. Resources, it could be financial, it could be technical, it could be time resources, But like I said earlier, leverage the free resources more. There are hundreds of free resources that we can use to do a lot of our community engagement that we're not leveraging. Start from today. And you need to have an evaluation metrics that you can use to evaluate the impact or effectiveness of your intervention or initiative. Now, tailoring messages to audience. Messages should be customized. You need to use materials that will resonate with the cultural or linguistic or informational preferences of diverse community members. In one of our sessions, I shared a story how a particular organization flopped, because they had a very low cultural intelligence of the community they were carrying out the intervention for. They were trying to promote a particular intervention that has to do with pregnant women, So they came up with a calendar that showed a pregnant woman, with her bulging tummy out. This woman was not putting on anything, just the tummy that was in the picture. Do you know because of that, that intervention failed? Because they didn't factor in the religious belief of the people of that community. The people of that community are religious persons that don't believe in exposing any part of their body, particularly the female folk, exposing the stomach, and they are using that to as a means of communication to pass your information to them. That message didn't fly at all, and intervention failed. So upon evaluation, that's when we realized that, okay, the reason why this intervention failed was because the cultural values and the religious norms or beliefs of the community were not factored in designing messages. So you should know how you're going to communicate with the member of the community, factoring their culture, their languages, various preferences. You need to understand how diverse the community is, and you factor in a lot of things. If it's a community that is highly religious, you factor in the religion aspect of the intervention. If it is cultural, you need to factor in their culture, integrate the culture into your intervention. It's important. Utilizing multiple platforms. Employ a mix of traditional and digital communication channels. I've said that a lot, including social media, websites, community meetings, and print media to reach a broad and diverse audience. There are quite a number of free tools available that we can use for any of our strategic community engagement. When we talk of community engagement, we don't just talk about the traditional community engagement. You can engage digitally, okay? You can engage digitally via the use of social media platforms such as Facebook, Twitter, and the rest of you. If you have a website, you can use a website. There are other digital tools that you can have. You can host a website like Medium. You can use it for your messaging and all of that. There are so many. Okay, ensuring accessibility and clarity. You need to make your information easily accessible and understandable by using simple languages and by using visual aids where necessary. Because picture speaks more than words. So sometimes there are some intervention that you want to carry out, for example, hand hygiene, how people should wash their hands. Instead of using a lot of languages, just demonstrate in pictorial formats how people wash their hands, step 1, step 2, step 3, pictures without much writing. Okay. Now, this is one of the case study. The essence of this is to make us understand how strategic community engagement is. This is one of the interventions we did in 2020 in Kaduna State, which was tagged capacity building on infection prevention control for COVID-19 among frontline health workers in Kaduna State. Okay, and thankfully, this intervention got the attention of the World Health Organization, and it was considered as one of the 40 interventions across the globe, which was published in the WHO website as a case study. This is one of the work which I did in Kaduna State. Okay, and the background, the essence of this work, we realized during COVID, everybody was panicking, everybody was scared. Even the health workers became so worried. They were quite very scared about the novel virus, coronavirus, and you can imagine those who are meant to confront the disease are also running away from the disease. It means the matter was dead serious. And what do we need to do at that point in time? We started consulting. We realized that there was no enough knowledge on infection prevention control among the frontline health workers, particularly those of low cadre in the primary healthcare centers and some selected private clinics. And we wrote to the Kaduna State Primary Healthcare Board seeking their partnership. That's an engagement strategy because we identified they are part of the relevant stakeholders, apart from the healthcare workers, apart from the members of the community. The relevant stakeholders are the State Minister of Health. We contacted the State Minister of Health, contacted the Kaduna State's Primary Healthcare Development Board, and we granted waiver to carry out our training in partnership with the Kaduna State Primary Healthcare Development Board in 2020. In the course of this intervention, I want you to go straight to the results. we're able to boost the confidence of the frontline health workers and non-health workers, because people understood how to prevent themselves, how um, how the various infection prevention control mechanism, they understood it better, and improved knowledge and skill sets of 605 frontline health workers on IPC for COVID-19, because we impacted the lives of 605 frontline health workers across the state. Workers are able to protect themselves, patients, and their community, and that significantly reduced the spread of the virus in Kaduna State as a result of this intervention. Okay, so this is the reason why I had to bring this picture is to just give you, and this picture I downloaded from the website of WHO. You know, it was published in 2023. It's my work. You could see my name there, Zachary Siaka Osheku. We did alongside with other members of Primary Healthcare Initiative Africa as a group. I was the person who handled this presentation during the online exhibition, which was carried out by the World Health Emergency Group. So the point is, you need to understand strategic community engagement, the relevant stakeholders, who should be the first. Anytime you want to carry your intervention, you need to identify who is the number one stakeholder that you need to engage. After this, who is the next? Who is the next? It's important. Now, how you can overcome some resistance, because in trying to carry out some intervention, there are certainly going to be resistance to change. Address resistance to change by engaging in proactive communication, providing education training, soliciting feedback, you know, and input from stakeholders. If you do all of this, it will help you in proactive engagement where you can engage meaningfully with the relevant stakeholders. And if you do a lot of training, provide the relevant education and training about your intervention, and you get feedback and inputs from these stakeholders, it will help in resisting some of the resistance that you're going to get at the end of the day, because of course these persons were carried along in the course of this intervention. So you're not going to most likely get feedback. Resource constraints. People say we don't have a lot of resources, we don't have money, we don't have time. They are resource constraints in most cases. I've said that earlier. If you look at the point I highlighted with red, leveraging existing resources and infrastructure, there are quite a number of free available resources and infrastructure that you can utilize to carry out in your intervention. So it's important we utilize or we leverage these existing resources and infrastructure a lot before we can even start thinking of going external. So these are strategies you can use to mitigate resource constraints. And you can do this by prioritizing engagement activities based on their potential impacts and return on investment, or you seek external funding or partnership, and you leverage existing resources and infrastructure. It's important. Maintaining engagement momentum. You need to sustain engagement momentum by fostering a culture of continuous improvement. And this can only be done through monitoring and evaluation. When you have proper evaluation metrics, it helps you in sustaining engagement momentum, because you need to understand whether you are making progress, where are you making mistakes and all of that, and you correct that. You don't wait until after the entire intervention. As you kickstart the intervention, you check out for check the various indicators that you have set out for the intervention to see whether they are working or they are not working. Which one do you need to change? Where do you need to add value? Which one do you need to modify and all of that? Which one do you need to hold on to tightly? All these are vital. This is to show you how you can carry out your quantitative metrics and qualitative feedbacks, continuous improvement. So you can measure through a quantitative method, and quantitative methods of measurement, requires you using certain indicators such as participation rate or attendance number or survey responses, the outcomes achieved, or providing concrete evidence of impacts and progress. This is quantitative. So you need to set out what your indicators are. For example, if you want to carry out a particular intervention in a community, you need to have a certain indicator. Okay, I want my indicator to be participation rate. How many people do I expect in this particular intervention? Can I get up to 10? Can I get up to 20? Can I get up to 5? Can I get 2? Whatever be the case, you need to note it because that's your indicator. Attendance number, you need to find out how many attendance are you expecting to have. What are the responses that you're going to get? Okay, like I told you, the survey which I put on the platform in form of a poll for you to vote yes or no in order for you to see how your certificate should look like is a form of quantitative metrics because I'm trying to get the survey responses. I think it is only fair that in a group of about over 150 people, you're asking to get 50% responses, which is 75%. I mean, 75. I think in that group, we're about 150 something. So asking for 75 is just like asking for 50%. So it's a quantitative metrics. Whatever intervention you are carrying out, you need to have that in mind. You can have qualitative feedback, which can gather through feedbacks, through testimonials. At the end of the intervention, you can interview people. Okay, what is your thought about this program? Did you learn anything? Through focus group discussion, or you can interview them one-on-one, or through community forums and what have you, for people to share stories, about what they have learned or what they think or how they think you should do it better. We are going to do a qualitative feedback of this fellowship at the end of the fellowship. Survey is going to be sent out to you for you to respond to some questions and for you to also suggest ways of improving this particular Community Health Champions Fellowship. Continuous improvement. Emphasize the importance of ongoing evaluation, learning to inform future engagement efforts, identify areas for improvement, and ensure strategies remain responsive to evolving community needs and priorities. So all of these we're going to have at the end of this fellowship for you to respond to. Thank you. Any question? Any question? Any question? I think we can stop sharing now. Question. Everybody's quiet. Nobody's saying anything. Hello? Or was I just talking to myself? Nobody was listening. People were just signing in and doing something else.
No, we're listening. We were listening. I think it was a very good presentation and everything is quite straightforward. So, yes, thank you so much. We were listening. We just don't have any questions yet.
Okay, thank you very much. Unfortunately, you didn't tell us.
We were actually listening. Yeah,
you didn't tell us. If you want to speak, please say your name. Rumbi Sanderson. Please tell us your name and where you're making these contributions from. Thank you.
Okay, sorry about that. Yes, my name is Rumbi. I'm calling in from Zimbabwe.
Okay, thank you very much, Rumbi from Zimbabwe. Good to see you. Is this your first day of joining this session?
No, it's not. I've been following all the sessions.
All right, thank you so much. Any other contribution? Any other contribution? Question? Oh, I can see Elfas. You have the floor, please. You have the floor, please. Unmute yourself. Thank you.
Hello.
Go on, please.
I'm Elfas Kwet from Kenya. I'm calling not to ask a question, but to appreciate the time that you've given unto us and this opportunity. I've been following since the first day, and indeed I'm learning for myself. I'm indeed learning, and it is full of professionalism. And thank you so much. I believe that as time goes, we'll have more interaction. Thank you.
Thank you very much, Alphas, for being so magnanimous with your words. Thank you so much. Any other contributor? Please, this is an opportunity for us to share knowledge sharing, engage with one another. We can have a different perspective of the issue. You can even tell a story of a particular meaningful strategic engagement you had in the course of your work for people to learn from. Any volunteer is something that's going to be appreciated, honestly, I must say. Nobody from Nigeria speaking.
I'm here. I'm actually here. Sorry, Mr. Zach. Good afternoon.
Who is speaking, please?
My name is Dolapo Ademo.
What am I going to get?
Go on, please.
Good afternoon, everyone.
Yes, good afternoon on their behalf.
My name is Dolapo Ademuago from Nigeria. Sorry, please, can you actually recap that measuring success? Sorry, I got lost along the line.
Okay,
Thank you.
let's see. Let me get back to the slide to see. I want to assume you can see my screen.
Not yet.
Here? I want to believe here, right? Can you see my screen?
No, I can't see the screen.
No, sir.
I can't. No, sir.
Sorry, please. How about now?
Yes, I can see. Yes, I can see. Thank you.
Okay, so
Yes, I can see.
I did say, if you're carrying out any community engagement, you should have some evaluation metrics that will ensure whether you are making progress or all the various things you have set out, whether they are moving on well. Where do you need modification? And you need to understand how you can measure to know whether you are making success at the end of the day, whether you are making impacts or whatever you want to call it. So ideally, they are broken into three. One is quantitative metrics. This is how you can measure success, by setting out a quantitative indicator. Quantitative indicator in this case, on how you can measure participation rates. If you say quantitative, you can see it's definitely something that refers to a particular number, or maybe like 10 participants, 20% of attendance, 50% responses. It starts to a quantitative value. Okay, that's quantitative. You measure quantitative indicators. There are so many indicators. Indicators can be based. People who have understanding of monitoring and evaluation would understand what I mean by indicators. So in this case, your indicator can be attendance number, survey responses, or the outcomes you have achieved. Then qualitative is something that is more detailed. So you are trying to get the perspective of different individuals by engaging them through interviews or by bringing them together to come to a particular gain of the intervention or what they have learned, or by asking them to give you testimonials. If I want to get testimonial from each and every member of Community Health Champions Fellow, believe me, I'm going to get 50 different feedbacks or testimonial from 50 different people, because your testimonial Dolapo is going to be different from the other lady from Zimbabwe, and it's going to be different from somebody from Kenya, or it's going to be different from somebody even from Nigeria, because you are getting a detailed view of people's perspective, understanding. So qualitative feedback, you get it through interviews, through focus group discussion, or by trying to get testimonials from people, or for people to share their experiences, their perspectives of the whole thing, or stories. All right. That is on quantitative and qualitative. Then the next is continuous improvement. You emphasize the importance of ongoing evaluation. There should be a monitoring and evaluation put in place, that will identify areas for improvement. We need to check out. All right. All this answers the question. I wouldn't want to say much. Any other contribution? Let me stop sharing. Felix Thomas, you have the floor, please. After Felix Thomas, the next is Abdul Mumini.
Good
evening. Please, Felix Thomas, you have the floor. We're waiting for you. Okay, since Felix Thomas is not ready, the moment you have the floor.
Hello, good day, everyone. I'm Abdulmumin Rabiu Ali from Nigeria. Firstly, I have to start by commending you for the wonderful work, and actually the engagement I'm having presently is up to what I'm expecting. In fact, it's even beyond to what I'm expecting. It's actually reaching me with a lot of knowledge based on the community health, and as the topic of for today, that is the community engagement. I have questions. I have some questions here. Two questions with me. Number one, talking about the stakeholders. As you mentioned, we have two stakeholders. That is the primary and the secondary. So my question here is, whenever I'm going for let's say community engagement, which one should I be in contact first? Is it the primary stakeholders or the secondary stakeholders? And again, is there any possibility of, let's say now, ranking them, which one is of utmost priority than the other? And the second question is talking about the measuring of after community engagement. Now I want to rate my engagement. That is talking about the qualitative and the quantitative indicators, and maybe the continuous evaluation. Is it that I have to look into all the three, that is both the qualitative, quantitative, also the continuous evaluation, or I can use just one, or it depends on my engagement that I'm carrying? Thank you.
Okay, thank you very much. I'm really joining us from Nigeria. Like we said, you mentioned two types, primary stakeholders and secondary. And I said primary stakeholders, those are the ones that are directly affected or that are directly influenced, can be influenced by your initiative or your objectives. All right. For example, if I want to tackle cholera in a certain community, XYZ, who are the people that can actually be affected by this intervention? They are mostly children, of schooling age, particularly under 5 children, and maybe women that nurse these children, So I'll look at maybe schools, primary healthcare centers. These are my primary stakeholders, because these are the people that can be influenced or affected directly. The children, once they have cholera, they are going to miss school. So they are affected, they'll fall sick. The mother, once a child becomes sick, she's affected because she needs to invest more time in taking care of the child, taking the child to the hospital and all that. She's affected. She will not be able to do her business and all of that. She's affected. The school is affected because the child is going to miss school. So the school attendance rate would have reduced by 1. Okay. And the primary healthcare centers, it means they are going to be more burden on the PACs in that community. The more people who had cholera in the community, the more children are going to be flooded into the PAC. So in a simple way, these are the primary stakeholders. Okay. The secondary stakeholders are those that, are not affected directly by the intervention. It could be neighboring community, okay, for example, if people have cholera in this community, or there's a particular incident in this community that makes people to start running to other communities, those communities are not affected by that directly, but by extension of the problem this community is having, they are indirectly affected, possibly because they are housing more people than they should. There is a lot of pressure on their existing infrastructure over there. So this is just the way I think I can put it. Okay. So basically, your attention is on the primary stakeholders, because those are the people that you want to impact directly, or you want your influence to reach. Okay. But notwithstanding, it's not to say you do it with the secondary stakeholders. Now, talking about measuring success, you don't necessarily use all the various methods. You can just use one. Okay. You can use 2. It depending on what you want to get. For example, if I don't want much information, did you enjoy this fellowship? If I say, did you enjoy this fellowship? Yes or no? People will say yes, some people will say no. This is not detailed enough. And this is quantitative, because I'm just trying to get the very responses of the people. I mean, I don't want to go detailed. Did you enjoy this fellowship? You can either say yes or no. If you say yes, the information is not detailed enough. So it depends on what you are looking for. If you want detailed information about your intervention, you can ask open-ended questions. By asking open-ended questions, you can ask questions for what did you learn, or how was this fellowship impactful? Because I'm asking of how. You cannot say yes or no. In this case, you can say, okay, the fellowship, I was able to learn this. I was able to learn public health principles. I was able to learn this. You are going to be detailed about it. Hope that answered the question. Thank you. So I want to believe there's no more response at the moment. We should have even recorded these parts. Unfortunately, I stopped recording. But anyway, it's good to those who don't attend to the meeting. Any other contributor? In the absence of no contribution, in the absence of no question, so our next meeting, we shall.
Hello. Hello.
Yes, Paul.
Hello.
Yes.
Yes, I'm coming from Kenya.
Okay.
Hello.
Go on, please. You have the floor, sir.
Mine is not a question, but a compliment for a well. Okay, mine is just a compliment for the well presented presentation.
Thank you.
So thank you for a good presentation, sir.
Thank you very much. Thank you very much, Mr. Paul Kamal from Kenya. He is not asking any question. He's rather just throwing compliments. One thing about compliments, well, maybe some days I can just talk something about gratitude. Gratitude has a way of opening doors for people. Okay, so it's good we learn how to extend some level of gratitude. By just simply say thank you, or just something, not necessarily for this fellowship, somewhere else. Okay, it helps a lot. Anyway, that's just by the way. So thank you very much. We're going to communicate with you on how you're going to carry out your capstone project and how it
Yes,
should
sir.
look like. Nothing is scary. Do we have 75 numbers, to see if we can share the sample of the certificates? If we don't, it means people are not ready. Are you ready to have this? Are you ready to see the certificate? Can I get a chorus? Yes.
Hello, sir.
Yes,
Yes,
yes, yes.
yes, yes,
Hello,
yes.
sir. Yes, sir. Yes, sir.
Yes, please.
Yes, yes, yes.
Yes.
Okay.
Yes, sir.
Okay,
Say
okay.
big
Somebody wants to say something, please. I think it's Hussein Mohammed, right?
Yes, sir.
Please go on. You are muted. Unmute yourself, sir. Hussein Mohammed, please unmute yourself so that you can speak. And be very brief. Thank you. Are you speaking? We're not listening to you. Okay. Hussein Mohammed is not speaking. Possibly, maybe he's speaking, we're not hearing him. But I don't know if anybody can hear him. I obviously cannot hear anything. So, unfortunately, we cannot hear Hussein Mohammed. So, at this point in time, I would like to thank you for finding out time to join this fellowship. I understand it's quite a very difficult moment. We're all very busy. For somebody to commit to 1 hour, join a fellowship program online, it's not easy. It's commendable. And I can assure you it's something that you will never regret being part of. Okay. And whatever support we can render to you now
Hello.
and in the future.
Colleagues. Hello, good evening, fellow colleagues. Hello, good evening, my fellow colleagues.
So, like I did say, this fellowship is quite very important, and I want each and every one of you to take it as important as the oxygen you breathe in, because sometimes when you have an opportunity to join a fellowship, most people don't know the opportunities this can unlock, especially when you are part and parcel of the fellowship from A to Z. It's important because anybody who joins this fellowship from A to Z, at this point in time, the person will realize that, yes, this is knowledge-packed fellowship. It's quite interactive. A lot of information has been shared, and this information is to increase our reservoir of knowledge, as we go about our various activities in our communities. And believe me, it's going to open a lot of doors of opportunities for you if utilized meaningfully. So thank you very much for that power-packed fellowship, from Taiwo. Thank you very much for the comment. So somebody was trying to speak. I think it's Okasha. I think you're the last person I'm going to give an opportunity to speak. If you are still available for any whatever, you can unmute yourself and just quickly share the points. Thank you, Okasha.
Thank you so much, my leader.
You're welcome.
Evening, my fellow colleagues. I just want to make my emphasis, as you just guided and commended, that is very important, this kind of program, because it is added value to our knowledge of reservoir. Most of especially, some people see program like this online, they will take it as if it's just wasting of time. How can someone graft something that is very paramount online, something of that nature? But to people like us that are in the profession, people like us that have the zeal and mindset of changing other human being lifestyle through innovative and healthcare promotive, most of especially public health of today. The public health are playing a vital role in promoting and improving the community bad habits and lifestyle of stagnated environment, poor personal hygiene, and non-meeting of the hospital and other medical checkup like this. Is the primary assignment of public health practitioner technician or physician or community health practitioner or community health officer or environmental health is almost the same thing, vice versa. My advice goes like this: please and please, since we undergo such program like this, we should try and educate our people that are very close to us. The first contact, you should try and be organizing such a thing to your community, to pupils in the schools, and so on and so forth, so that at least we can wider spread the program within the vicinity of our country, state, local government, wide, and rural area. That is my suggestion and contribution for today's lectures. Thank you so much, my respected colleagues.
Thank you very much, Mr. Wokasha Haruna, for such a very detailed and very useful and yet valid contribution. Honestly, you said it all. You know, it has to be a knowledge transfer. You know, the essence of these is for you to get the knowledge and as well pass it to as many persons as possible in your community. And that's the wisdom behind the Capstone project, okay? So it is expected that each and every one of you should engage in a Capstone project, something very small, even if it's to one or two individuals in the community. And we need to see images of that. And like we said, it's going to be shared on our various social media platform. You know, it's going to be shared on our website. And at the end of for the successful graduates of this fellowship, we are going to have a collage of their names with their country, and it's going to be uploaded on our website and possibly also shared on one of the, reputable online platform, any of those, what do you call it, blogging sites. We can just look for one or two that's not expensive, not too expensive for us to afford, and we place it out there. Like I said, as a public health person, as a community health champion, it's important you create visibility for yourself. And that's why you see a lot of people that know too well better than what you do, but they are struggling to succeed because they have a very low visibility. And platforms like this, if you leverage it effectively, it can give you visibility, in such a way that by the time somebody searches your name online, for example, if you just type Rumbi Sanderson, you should be able to see who Rumbi Sanderson is. It will tell you a lot that, okay, for example, she's a public health physician from Zimbabwe, or she's a nurse, or she's this, she's that, and all of that, okay? Or maybe if you type, maybe, Adi Janet, or let me use the email this time, Gideon Innocent. If you type, it should be able to tell you who the person is. This person has participated in Community Health Champions Fellowship under the flagship of Digital Innovation School of Health from so period to so period. So it's not by accident. You need to be intentional in terms of promoting who you are, promoting your work. And that's why whatever little opportunity you have, do not waste it. Utilize it effectively. Final contribution from Adumim. I gave you the opportunity to speak, but unfortunately, you were not saying anything. Please, you are the last person. In 1 minute.
All right. Thank you, sir, for the opportunity. I think you just said the successful fellows, and I don't know. I'm sorry, I missed your presentation, the last presentation you had, and probably maybe you might state out the criteria for someone to be a successful fellow. So I don't know if you can give a little recap of that, let's say in brief.
Sorry, Abdulmumini, did you join the orientation?
Yes, I joined the orientation.
If you join the orientation, you should understand who the successful fellows are. I think we stated it there, but just in order to save your time, successful fellows, we have our criteria in terms of participation on the online session, in terms of the submission of assignments, and ultimately in securing a certificate. So if you must be a successful fellow, somebody who eventually would have a certificate, and not everybody will have it. If you don't attend the online session, you don't participate in any of the assignments, trust me, you're not going to get any certificate from us. no matter what you want to pay, our certificate is not for sale. Is for those who truly deserve it. And even though there is a nominal charge attached to it, something very small, you get. So that's what we mean. By the time we have them, we are going to provide a form where you fill in your detail, your names and your country, you know, and we'll design a collage with your name, and it's going to be uploaded on our website and also be promoted on some of the, you know, media platforms that we can afford. So that's it. Hope that answers the question.
Yes, thank you, sir. I really appreciate.
All right, thank you very much for your time. It's time to go. Today we stretched this a little bit. We ought to have ended by 6, and I'm somebody who is very particular with timing, so apologies for extending this by at least more than a quarter. Thank you so much for your time. This session is recorded, and for those who missed this session, you should be able to find it online, you know, to watch. We'll share the links as well. Thank you. Have a lovely day ahead.